The best way to deal about COPD is to try to avoid developing COPD and developing the disease. One of the major causes of COPD is smoking. There's other causes as well, but the major one, the most common one, is smoking. So one of the things that I'm going to talk today is about how to avoid getting there and how to try to quit smoking. I always talk to my patient, give them 4 points to plan to quit smoking. It's a very hard habit to stop, so you have to help them the most possible way in order to be able to be effective. The first topic I talk to them, I say, always put the cigarettes and all pertaining to cigarette smoking in one place, like a drawer in the kitchen or a drawer in your room or any other place in which every morning you're going to go there, you're going to have a notebook and a pen, you're going to write down the date and the number of cigarettes you're going to be smoking that day. By doing that, even if you don't think about it, you're controlling the cigarettes instead of allowing the cigarettes to control you. So that's going to be the first thing that they're going to be doing. The second thing they're going to be doing is trying to find a hobby that they can do, something with their hands, so that their minds will be occupied, so that they will, instead of getting to a cigarette in their hands, they will do that hobby. Sometimes some patients do weird things, like, for example, they do sculpturing. They take a piece of wood, they sculpture birds, they paint it, and they develop something like that. Sometimes they're not as good in that, so they do other things like writing. Sometimes people decide to write about their kids. I have a lady who once decided to write about the 3 children, and she took a notebook and she started writing since conception of the child, all through the years, until the children got married and to whom they get married, and she put in that notebook, and she wrote in that notebook everything about what her feelings about all the situations through the life. Other patients do different things. Sometimes they start doing Sudoku, they start doing puzzles, they start doing different things, but the main thing is get their hands occupied with something and get their mind occupied with something. The third subject that I tell them, the third topic that I put them, write a contract. Write a specific contract, and you're going to place that contract in different places of the house, the kitchen, the living room, the area where you watch TV, any place where you're going to be with other people. People will talk about the contract, and the contract, basically what it will say is the date you're going to quit smoking. It will say, I, your name, will quit smoking, the date, and a signature. And I tell the patient that signature is very important, because people are going to go after that the day you decided to quit smoking. And I usually tell my patient, do it after 2 or 3 months, don't do it within a month, because a month is very difficult. And the last thing I say to the patients, make sure you start doing this as soon as possible, because the sooner the better for your COPD. If you develop COPD because of cigarette smoking, it's a very hard habit to quit. There's no easy way out. Some people do it cold turkey, they're strong-willed, but you have to have a strong will and you have to plan ahead of everything. One of the things that is very important also is to quit smoking inside of the house. When you make it more difficult for you to smoke and you are able to get out of the house to smoke, you're going to think twice, especially with the cold weather like we have today. Thank you very much.